This week's Team Huddle will be a reflection upon the profession of nursing. The ability to reflect is essential in the process of critical thinking and clinical reasoning. It allows you the opportunity to think critically about a topic and begin to analyse it in greater detail. This process takes time and the ability to distance yourself to be able to see something from different perspectives. Did you ever give much thought to your own profession? Have you ever really thought about the nursing profession? How do you feel about the different aspects of it? Sure, you thought about nursing before you decided to begin your education, and to be honest, at that point, you probably didn't have a clear idea. When you became a nurse, you were so busy treating patients and all that goes along with that you likely didn't take a step back and really think about your own profession. As you watch this video, I want you to think about how you feel about Carol Lauren. This is the third week of caring for her in the patient care scenarios. What impact has her situation had on you? How do you feel about patients in general? And what do they mean to you? How do you feel about the whole nursing profession? What do nurses bring to their work? What makes them different to other healthcare professionals? How do other professions see the nursing profession? How do they view nurses and what nurses do? And what is the importance of trust, value, and respect? Think about these questions related to your profession, but also how they relate to the way you like to be treated and how others like to be treated. Now, reflect on how you feel as a nurse. You will obviously be thinking about your previous experiences. How do you feel about the way others see you? Do you feel an equal member of the team? Where do you fit on the team? Where's your place? Is your voice heard? Nurses have a lot to offer about their patients. Objective and subjective assessments, insights, information about influencing factors, etc. Are you valued on the team and in the patient care continuum? Is your clinical assessment trusted? Are you respected? In a face-to-face classroom setting of this course, a group of 30 nurses was asked to put into words what they thought about how others see nurses and the profession of nursing. These are the words they used to describe what they thought patients felt, based upon their interactions with patients in the clinical setting. It was a little harder for the nurses to imagine what other professions thought about nursing. The nurses used the impressions they were given when interacting with other healthcare professions in the clinical setting. Those impressions relied upon the way they were made to feel by others. When those same nurses were asked how they thought nurses felt about their own profession, they used their own ideas and emotions to describe nursing. This last question brought a lot of discussion, and the nurses felt that even though all the professions have a different focus and come from a different place, their ultimate purpose is to further patient outcomes. They are there for the patient's benefit, as are nurses. At the beginning of this team huddle, you are asked to reflect on something specific. Now that you have seen and heard some alternate perspectives, take a look at the list again and decide if your thoughts may have changed. Keep these ideas in mind as you move to work on the case scenario.